Welcome back to Doc Saying Stuff. I'm Dr. J. Rutland. We've all been in those arguments with friends or relatives. We go back and forth. Someone shouts, "You're a narcissist." We sit back and think to ourselves, am I? Maybe it's just happened to me, I don't know. But I've often wondered if I am one. In the quest to better myself, I had to look up what narcissistic personality disorder is and if I was or even had a few characteristics of it. How could I be better? Let's talk. Narcissistic personality disorder is a pervasive pattern of grandiosity in fantasy or behavior, need for admiration, and lack of empathy, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Has a grandiose sense of self-importance, exaggerates achievements and talents, expects to be recognized as superior without commensurate achievements. 2. Preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. 3. Believes that he or she is special and unique and can only be understood by or should associate with other special or high status people or institutions. 4. Requires excessive admiration. 5. Has a sense of entitlement, unreasonable expectation of especially favorable treatment or automatic compliance with his or her expectations. 6. Is interpersonally exploitative, takes advantage of others to achieve his or her own ends. 7. Lacks empathy, is unwilling to recognize or identify with the feelings and needs of others. 8. Is often envious of others or believes that others are envious of him or her. 9. Shows arrogant, haughty behaviors and attitudes. If you have 5 or more of those, you have narcissistic personality disorder. In the US, the prevalence is 5 to 15%. This seriously could be any of us, but I definitely have some of these characteristics and need to own it. The thing about narcissistic personality disorder is it usually is comorbid with other disorders, particularly substance use disorders, bipolar disorder, and other personality disorders. In fact, this is how people normally present, and most commonly co-occurs with antisocial, histrionic, borderline, schizotypal, and passive-aggressive personality disorder. Narcissistic personality disorder spans the broadest spectrum of severities. There are high-functioning individuals, low-functioning individuals, middle-functioning individuals. As clinicians, we have to distinguish between grandiose and vulnerable subtypes. To identify the presence of any personality disorder, a standard psychiatric interview is often used to make a diagnosis. Otto Kernberg's structured clinical interview, which was created in 1981, has continued to undergo revisions and restructuring as a structured clinical interview for personality disorders. The current version is a semi-structured diagnostic interview with questions focused on personality organization, defenses, object relations, and coping skills. The current version is copyrighted by Personality Institute at the Weill Cornell Institute. The interview is based on psychodynamic principles and is expected to be used by persons who have had previous training in psychoanalytical work. This is mostly used in research work, but the interview by a psychiatrist or an analyst is of the utmost importance. I personally find all of this fascinating, as we all walk a tightrope between confidence, arrogance, low self-worth, and low self-esteem. There's no obvious treatment for narcissistic personality disorder, but we do treat co-occurring affective disorders. Once the patient is aware of the diagnosis, long-term therapy between a therapist and patient is the focus. Patients may benefit from treatment of their other symptoms. Antidepressants, antipsychotics, and mood stabilizers are used as well. It's been kind of heavy researching this topic because it's perceived as so negative, but I wanted to educate others and myself. I learned a lot with a deep dive on narcissistic personality disorder, and I hope you did too. We'll see you next time on Doc Saying Stuff.